It's a great pleasure to be here. Perhaps I'll start off by saying that for cardiovascular disease, the attributable risks for stress are on par with that for smoking, elevated lipids, hypertension, and diabetes. Pretty stunning risks. Though relatively little is known about the mechanisms that translate that risk into cardiovascular disease events. Some ideas. Stress could affect behaviors and factors that increase stress. For example, hypertension, smoking, physical inactivity, and overeating are all associated with stress. But they don't nearly come close to explaining that increased risk that we see with stress. For example, this well-traveled slide here is taken from the study called the INTERHEART Study, published back in 2004. It looked at tens of thousands of individuals, 24,700 or so, across the world, and looked at the impact of stress after controlling for all those other risk factors as it relates to cardiovascular disease. And here you can see the odds ratios. Anything greater than 1 means that it's increased in risk. And you can see here throughout the world, stress accounts as an independent risk factor for cardiovascular disease events with a roughly 50% increase in that risk. That's a large magnitude. Now, how does that play? We can look at human studies, but perhaps some of the most elegant studies that we see are animal studies. So this is one animal model of stress. You can see the poor mouse here and the cat on the cage. You can create this model with that, or you could shake the cages for a long time. Either way, with these models of stress, what we have learned recently over the last 5 years is that some things that we didn't anticipate happen were actually occurring to a large degree. For example, the bone marrow becomes quite upregulated, starts to produce a lot of inflammatory cells. Those cells then go to the spleen, and then they creep into the arterial wall. So the artery wall, like the carotids, which can cause strokes if they become occluded, or the coronaries, which lead to myocardial infarctions. So this arterial inflammation results from increased stress. So this is the kind of model that the animal studies have taught us. You can have stress causing sympathetic nervous system activation of the bone marrow, the release of these progenitor cells and inflammatory cells. They go to the artery wall and lead to a heart attack. It turns out that heart attacks and strokes beget more stress. So then you have this vicious cycle. Our atherosclerotic disease events beget stress, beget inflammation, beget stress, and so on and so forth. Does this occur in humans? That's one question that we're interested in. And also, how does the brain actually fit into this? What is the mechanism? What is the signal that comes from the brain and leads to these things that we just described? Well, there are ways that we can look into that. There are cutting-edge imaging approaches. We just heard about one of those approaches using MRI to look at that. One of the areas that we would be interested in to look at stress is the amygdala. It is the part of the salience network. When things change in the environment, the amygdala becomes upregulated. What we've learned from fMRI studies is that individuals with more active amygdala by these fMRI tend to have more subclinical atherosclerosis and produce more inflammatory cytokines. Let me explain what this slide shows. So if you look at the amygdalar activation by the imaging scan, those who have more activation end up having more enlargement of the carotid artery, the vessel going to the brain. And you can see the way that they try to increase the activation of the amygdala is by flashing faces. If you can see this, I'm not sure this really shows well in the back of the room. These anxious appearing faces, when they're flashed, cause the amygdala to ask what's going on, why is somebody looking anxious, and that triggers more flow in that region of the brain. And people who have hypersensitivity of that region of the brain tend to also have more atherosclerosis, but also they tend to produce more inflammatory cytokines. So far, this is jiving with what we saw in the animal models. Another way to look at the same areas is by using fluorodeoxyglucose PET, so positron emission tomography. And what this does is it accounts for the tissue's glycolytic rate. I'm not going to belabor this slide, but I'm going to summarize and say that we use this clinically to look at brain activity, inflammation, and tumors. So now in terms of the brain activity, if you look at a primate model of anxiety and very nicely and carefully quantify anxious temperament by observing these animals for a long period of time, and then subject them to PET imaging of the brain, and here are the right and left amygdalae, you can see that the anxious temperament scores very nicely relate to the activation of the amygdala. Fortuitously, and by good fortune, we can see that the same imaging approach could be used to look at the arteries as well. We know, for example, that the metabolic activity of inflammatory cells very nicely correlates with the amount of activation, the pro-inflammatory activation of those cells. So this is in vitro. But then if you look into patients, in humans, arterial FDG uptake nicely correlates with arterial inflammation, macrophage density. Moreover, the inflammatory signal we get from humans very nicely predicts their subsequent risk of heart attacks and strokes. So this all fits nicely together. We can use imaging to look at the brain and associate it with the activation of the salient network and stress. We can also look at the blood vessels to see how much inflammation there is and the risk of atherothrombotic events. So with this as the background, we sought to assess whether the activity of the stress-related neural centers of the brain associate with subsequent cardiovascular disease events. In other words, we wanted to see if the degree to which the amygdala activates is associated, as they were in the animal models, with progenitor cell release in humans, arterial inflammation, and subsequent heart attacks and strokes. We hope that future studies could further evaluate whether interrupting this mechanism can actually reduce the cardiovascular disease events that associate with stress. So how can we do that? Well, one intriguing way to consider doing this is by mindfulness-based stress reduction. Interestingly enough, this is something I knew nothing about. I wouldn't want to tell you how recently, but in any case, we do know that change in this perception of stress scale that associate with mindfulness exercises very nicely is associated with reductions in the gray matter within the amygdala. You can actually shrink that portion of the brain that is triggered by fear. Moreover, a recent study published just last March in Circulation took 577 individuals who had a recent myocardial infarction or had very high risk of cardiovascular disease and had recent cardiovascular interventions. And they took those and randomized at the end, it was 151 individuals, to either standard cardiac rehab or cardiac rehab with a stress reduction approach. Let me start off by showing what happened to lipids, cardiovascular disease biomarkers, and aerobic fitness. Not much of a change. So not much happened there. They both had the same cardiac rehab, so the intervention on stress did not affect those biomarkers. On the other hand, anxiety and stress went down very nicely. You can see here the various scales that they use. I'm not going to belabor the minor differences between them, but overall, anxiety and stress were nicely reduced by this intervention. More impressively, here you can see cardiovascular disease events, when you follow these individuals over 5 years, were reduced by 50% in the individuals who went through this stress reduction training. 50% is a major reduction. There are no new drugs that we give for individuals with chronic atherosclerosis that have so far been able to produce those kinds of benefits. This is a small sample size, but obviously more study is needed to evaluate this. But given the theme of this forum here, one of the things that we see also is clearly that stress is reduced by being exposed to green spaces. And this is something that prior speakers have provided much information on. I'm not going to belabor it here. So a natural question, no pun intended, that comes from here is whether or not these same benefits to the system I just showed could be influenced by exposure to the environment in green spaces. So in summary, chronic stress is a major independent risk factor for stroke, myocardial disease, as well as several other inflammatory disorders. Activation of the brain's fear center seems to play an important role in the development of arterial inflammation and subsequent cardiovascular disease, and reducing chronic stress may provide important and durable reductions in cardiovascular disease events. Thank you for your attention.